I would like to talk to you about something that is often missed in my patients because of few common misconceptions, and that is sleep apnea. My name is Dr. Damiana Korka, and I'm a holistic sleep specialist. And let's look at sleep apnea because it's something that I see in my practice all the time, and it's very interesting because I work with a lot of people who are very fit and they're athletes and they're not overweight at all. And the common misconception around sleep apnea is that you have to be overweight in order to have sleep apnea. And that is true in certain cases, but I have a lot of patients that when we look deeper at why they can't sleep well at night or why they feel so exhausted when they wake up in the morning, they realize that sleep apnea is indeed an issue. So what is sleep apnea? In very simple terms, is interrupted breathing at night where the oxygen saturation drops, and then when it drops low enough, then the tendency is to kind of recalibrate or gasp for air. And some people snore, but not everyone that has snoring has sleep apnea, and the other way around, not everyone who doesn't snore doesn't have sleep apnea. So that is not a very good way to gauge if you have sleep apnea or not. We have two types of sleep apnea. The most common one, over 90% of the cases, is obstructive, where literally there is inflamed tissue or narrow airway, and we call that obstructive sleep apnea. And then we have central sleep apnea, where basically the brain is not communicating with the breathing muscles, and then the breathing gets interrupted. And so some people get lucky. I mean, not really lucky, I'm being sarcastic, but seriously, they have both of them. So it makes the issue a little bit more complicated. So in general, though, in this talk, we're gonna just look at obstructive sleep apnea overall. With central sleep apnea, we don't really understand why exactly the body doesn't send a signal to breathe. But there are a few different things that can be done. At the root cause, we'll talk later about obstructive sleep apnea, that they can have the same root cause for central as well. So let's see. Why does this happen? Why do people develop sleep apnea? So one of the reasons is maybe you're born with narrower airway pathway, and then with aging and such, you're more predisposed to develop sleep apnea. But it could be other reasons too. And one of the absolutely biggest reasons is, no matter why it comes up, is inflammation. The inflammation could be there for different reasons, but the end result is that the tissue is more inflamed around the neck, and so then there is interrupted breathing. The tongue collapses in the back of the throat, and then you stop breathing for a while, and then you kind of the body sends the signal, wakes you up to breathe again, and you can repeat that cycle all throughout the night, many times an hour or many times per night. One of the reasons for this inflammation, it is extra tissue and extra weight. So we talked about being overweight being a problem, but it could be many other different reasons. And one of the most common things I see is nasal congestion. And we always think it's just seasonal allergies or something along those lines, but that nasal congestion means there is likely a lot more inflamed tissue around this area, and you're more predisposed to actually both obstructive or central. I think the large majority of patients that I work with that had central sleep apnea, they also had nasal congestion. So that was very interesting. Other reasons for having nasal congestion is I see an association often with gut issues. People who have, for example, seasonal allergies, the root cause is in gut issues, and there is often a correlation between food sensitivities and food allergies that make the seasonal allergies worse. So there is this cross reaction that a lot of people are not aware of that happens, and so eating certain foods will make the seasonal allergies worse. So that's one main thing that I always work on. How can we decrease the nasal congestion with herbs and acupuncture and whatever it takes, healing the gut in order to decrease that inflammation in this area so you can breathe better throughout the night. So let's see. Another common reason that I see is lowered hormones, especially in women, as they go through perimenopause, usually in their 40s, and then 50s and 60s in menopause and postmenopause. The estrogen, the sex hormone estrogen, as it lowers, our muscles become, they lose the strength. And so this applies to the neck, some of the neck muscles, and also the tongue muscle. That's a muscle, right? So that there is a tendency and an increase. I see an increased number of people or women as they go through perimenopause and menopause, and that estrogen drops. I see an increase in the apnea. So of course it's normal that the sex hormones decrease at this age, but also their optimal numbers within postmenopausal that period, and often that's those hormone levels are not ideal, and there is something we can do, we can measure, and we can see to find that sweet spot, so then you still have a certain amount of estrogen that's helpful. So that's very, very important. And usually with women, when this is the case, when the sex hormones are lowered, it's not one thing. The other thing, to give you an example, that changes is with the hormones dropping, we become more insulin resistant, which means that we have more issues with blood sugar, and when the blood sugar is not as stable as it could be, we're more inflamed. So that leads to more inflammation, and that feeds into the apnea situation. So you see how one feeds into another, and it's not one thing that will help this. It's a combination of things, and looking at the person and figuring out what's happening, why exactly for you this is happening. What are the probably 2, 3, 4 factors that are playing a role in why you can't sleep well and why you have insomnia. So let's see. So what do you do if you don't know if you have sleep apnea? So you can do a sleep study, and that's wonderful. The other thing that you can do that it's fairly accurate and helpful is to buy a continuous oxygen monitor. You can buy that online. It costs about $150. And the good part about that, as opposed to a sleep study, again, the sleep study, this is not the same as a sleep study, but it's helpful information to see if your oxygen drops at night. The good part about buying your own continuous oxygen monitor is that you have it at home, while the sleep study, happens over 1 or 2 or 3 nights maximum, and sometimes we may not sleep as well. We wonder if that was accurate and such. So you can do both, but definitely that is a choice to buy this continuous oxygen monitor that monitors your oxygen all throughout the night and when you wear it. So that's one. Once you figure out if you do have sleep apnea, what kind of sleep apnea, then how severe it is, we have mild, moderate, or severe, then you can take the next step. So if it is, especially if it's moderate to severe, or if you have a lot of symptoms, it is wise to start with a CPAP machine, which is kind of the standard of care for sleep apnea. Or if your doctor advises you can do a mandibular device where your jaw gets pulled forward, so then there is more space in your airway to breathe. So once you get those set, then you want to take it forward. You want to go to the root cause. Even if you feel better, you want to identify what is causing it, all these things that we just already talked about. You want to look at that, and that will be helpful, because it's not only that it will improve the severity of your sleep apnea and your sleep, but it will improve your overall health, right? We talked about inflammation. If you decrease the inflammation, it's going to benefit your health in many different ways, from cardiovascular health to healthy aging to walking around and exercising free of pain, and on and on and on. They're wonderful, wonderful benefits. If you have nasal congestion, again, look at why is that happening. Is there issues with the gut? Acupuncture can be quite helpful for the nasal congestion and for for the nasal congestion, and also for to reduce the inflammation overall. And in general, with acupuncture, we can use points around the neck. There are a couple of studies they've done in, I think in Brazil, where they did a number of acupuncture sessions and they needled. There are a couple of points around the neck, but there is one right here that goes inside to the root of the tongue, and it doesn't hurt actually. It sounds kind of like scary a little bit, like, oh my gosh, there is a needle going inside, but it's not a big deal really. And it can strengthen the tongue muscle by 50%, which is a huge number. Sometimes that's all we need. But most of the time we have to look at the whole person to again, to decrease the inflammation or whatever else we see that the root cause is. And if, again, with hormones, if that's an issue, we want to test and see how we can bring it, especially estrogen at an optimal level for muscle strength. And the other thing, of course, if there is weight issues, we often want to look at that. How can we decrease the weight? And of course, exercise is the most obvious thing, but it's often a lot more complicated than that. If you've had weight issues, you know that it's not that easy. So we look at the food, we look at food sensitivities. We typically do an elimination diet to make sure you're not sensitive to any foods, which actually feeds into this inflammation because it's related. And then the idea is to get on a food plan that's sustainable, that's really helpful, where you can drop the weight gradually. And also to make sure that your body doesn't feel like it's a constant fight or flight kind of a mode, because then you won't drop the weight. Think about it. If your body feels like you're constantly stressed, it thinks, oh, there is a danger and probably there is famine coming up, so let's hold on and to every little amount of fat because it's dangerous. There is something that might happen in the next moment. So sometimes you might starve yourself and you're still not losing weight, and it doesn't make any sense. And one of the reasons is because the body is to this activated stress mode where in an effort to protect you, it won't drop any weight. So there is that. And the other thing that I see very, very, very commonly, it's blood sugar issues. Even if you're not pre-diabetic or diabetic, some people hover over to that, close to that pre-diabetic zone. And as we have these sugar spikes that are too high and then too low, that increases the inflammation. And also for women, as I mentioned earlier, as we go through perimenopause and menopause, these blood sugar issues get exacerbated. And that's, again, one of the reasons, again, we have a hard time dropping the weight, and we accumulate weight around the belly and so on. Let's see, so what else? So there could be other different reasons. I'm just kind of talking to you about things that come to mind right now, but also toxicity. We live in a fair toxic world, with the food that we eat, pesticides, heavy metals, things that, even if you do your very best, it's likely that you have some excess toxins that maybe your body has a hard time eliminating, and then that increases the inflammation in your body as well. And let's see what else. So we talked about the lower hormones. The other thing that's also helpful, again, we're talking about a whole body approach, is actual exercises around the throat to strengthen the tongue muscles, strengthen some of the muscles around the neck. And there are special singing and tongue exercises that you can do, but also if you are into this, it's not that easy to learn it, but you can learn it, is playing the didgeridoo. It's a wind instrument, and it's really wonderful if you can manage to learn that circular breathing. Then it can really work with the tongue muscle and the neck muscles, and can be really, really helpful. I remember there was a study around this, but you'd have to practice, I think, for 20 minutes a day, I think for, I can't remember, 6 to 8 weeks, something like that, a couple of months. So it can be really helpful. It just needs to be done consistently for a while. And I believe that the circular breathing, learning that skill with the didgeridoo, is important rather than just blowing into it. So I think that's all I wanted to communicate with you. But as you can see, this is truly a whole body approach to sleep apnea, looking at it from different angles, again, getting diagnosed to begin with and see if that's an issue, seeing if you need a CPAP machine or a mandibular device, and then over a few weeks and months, really, and sometimes even longer, working at the root causes to decrease the inflammation, to strengthen these muscles. And the beautiful thing is that your health will improve overall, and you'll just notice being more alive, healthier. You'll be able to move better, exercise better, just really enjoy your family and enjoy your life, and age in a healthy way, so you can feel like your life is ahead of you and you can do whatever you want to do with your days instead of worrying about it. So thanks for watching this. Please let me know if you have any questions. I'd be happy to address them. Again, my name is Dr. Damiana Corca. I am a holistic sleep specialist and my website is damianacorca.com. Have a wonderful day.